in St. Paul's McGroveland neighborhood is a business that's kept the community healthy for decades,
All of the staff is friendly.
including 87-year-old LaVon Meyer.
I grew up with an independent pharmacy. It's just what I've always was used to.
Despite its loyal customer base and years of service, the future of the business is anything but certain.
I'd venture to say 99% of the people in the country have no idea what a PBM is.
John Hoshin has owned the pharmacy for more than 20 years. He points at pharmacy benefit managers, or PBMs, for making his business unsustainable.
There's no way to work yourself out of that financial rut.
PBMs entered the pharmaceutical scene in the 80s as Americans started filling more prescriptions than ever before. They work on behalf of insurance agencies to negotiate lower drug prices for manufacturers. They also fill the vital tasks of choosing what drugs to cover and offer pharmacies a place in their network.
But we can't continue to do business with PBMs who aren't willing to pay us what it costs to do business.
Right.
I mean, if I paid $100 for something and they're only going to pay me $94 plus nothing for my time, that doesn't work. I mean, that's not a business model that works.
Hoshin is talking about the reimbursements that PBMs pay to pharmacies for dispensing specific drugs.
As it is right now, it's virtually unsaleable. I would probably have a difficult time giving it away, the business.
As PBMs have grown, so too has their power. Hoshin says he nor any other pharmacy can serve patients who are represented by a PBM that he hasn't signed a contract with. And he says those contracts have made it impossible to keep the shop up and running.
I mean, I do think that reimbursement has gotten to the point where many pharmacies are determining whether or not they can continue current contracts with PBMs and whether or not they need to close shop, and you're seeing that trend play out. So that is a concern.
Joel Farley is a researcher and professor of pharmacy at the University of Minnesota, and he's worried about the results of pharmacy closures in both city and rural areas.
Pharmacies are really hubs for healthcare for a lot of patients in rural communities. Losing that could have a detrimental effect on those communities. You can think of one example with COVID. I mean, pharmacies really stepped to the plate in terms of providing vaccinations for patients, helping with COVID testing and other things. And losing that resource in the community could be a really big loss.
Reimbursements aren't the only aspect of the PBM to pharmacy dynamic Farley thinks could be an issue.
And another thing that happens in terms of PBMs is favorable contracting for certain pharmacies. So they may prefer in a PBM, one group of pharmacies over others. So independent pharmacies can be lost in that. At the end of the day, I hope that there's a way that we can maintain a model where they can get reimbursed adequately so that we can keep these pharmacies open.
As pharmacy closures continue to garner public awareness, PBMs have been put in the spotlight. Pharmacists like Hoshin are pushing for more regulation at a state and federal level. While those legislative actions work their way through the Capitol, PBMs are fighting back against what they call unfair attacks on their work.
Nobody has to hire a pharmacy benefit manager.
Michelle Mack is the Director of State Affairs for the Pharmaceutical Care Management Association, an organization that lobbies for PBMs nationwide.
We have been created because of a necessity, and we are doing, we're helping our clients because we are hired by our clients to like I said, bring down the cost of prescription drugs.
Mack and the PCMA argue that PBMs aren't to blame for pharmacy closures, but an evolving landscape and stiff competition in the industry are causing the closings.
So would you say it's unfair to hold PBMs responsible for pharmacy closures?
I would say, yes. I think there's a lot of entities in the supply chain. It's not just the PBMs that are in the supply chain.
As pharmacy closures continue to mount in Minnesota, loyal customers like LaVon are left to hope for the best.
I just can't imagine being without it. It serves my needs, and I just want it to continue forever, as long as I'm here.